quick one, guys. I always bring something that will help my dialysis patient. So let's quickly talk about the signs. Still on pulmonary edema case, signs patient undergoing dialysis, we see why having pulmonary edema, and also the management. Just a quick one for you to have a little tips on that as a patient undergoing dialysis. So one of the signs they see why having that pulmonary edema is breathlessness, and another signs they will experience is sweating, profuse sweating, and the person will find it difficult to breathe while sleeping, especially at night. They usually feel that way at night, midnight, 2 a.m. And also you see the person coughing profusely, coughing out some mucus that contain bloody stain on it. And another thing, you see the person heart rate will be high, which we call tachycardia, and also the patient will be feeling anxious while trying to breathe, at that moment, because that patient is trying to, take some air, take some oxygen, but she's finding it difficult to do that due to much accumulation of fluid in the lungs. How do you manage this patient that is experiencing this symptom? Maybe the patient badging and say, "Oh, nurse, I can't breathe properly." How do you manage this patient? First of all, if the patient is lying on bed, because eventually they can't lie down, they can't even lie flat, they can't sleep. So you raise the head of the bed on a high Fowler position, or let the person be in a sitting position. Then you administer 2 liters of oxygen immediately. Make sure, check patient vital sign SpO2 to make sure everything is okay. Then you will quickly program your machine. That's how we do it as a dialysis now. You just program what we call ISO-UF. That ISO-UF, that you are trying to take out more fluid from that patient's lungs within 30 minutes to relieve this patient from that distress. So you program your ISO-UF according to the patient weight. You assess your patient why the patient is still on oxygen and is being in a sitting position, because you are trying to relieve this patient from that distress of struggling to breathe. So you program your ISO-UF, remove more fluid from this patient's lung. And while doing all this, within like that 30 minutes of you programming that, monitoring your patient and the vital sign, you see this patient will remain calm and start sleeping. And make sure you check your potassium, check your sugar, monitor this patient closely. After 30 minutes of putting this patient on ISO, the patient will relieve of that distress, and you see the SpO2 without the oxygen. Then remove the oxygen, see the SpO2 will come up to 9900, because at first that patient SpO2 is dropping, the oxygen saturation is dropping because it's finding it difficult to get that oxygen. So with the oxygen during the dialysis, removing ISO-UF, making sure the patient is stabilized, watching the patient blood pressure, is good to go. If you find this topic useful, drop it on the comment section. Or if you're a patient undergoing dialysis, come across this video, ask a question and